emailed it to you, and I think Keanu may have a hard copy for you. If everybody's okay, if everybody's ready, please stand by. Good evening, Bermuda. Welcome to the weekly COVID-19 update press conference. We'll start this evening with remarks from the Premier, Honorable David Burt. Premier, please go.
Thank you, Director Wilson, and good evening, Bermuda. Thank you for joining us tonight as we outline. Let me begin by extending my condolences to the families of Mr. Marvin Lamb and Mr. Eugene Thomas, who sadly lost their lives after separate serious road traffic accidents on Tuesday. Our thoughts and prayers are with their families and their friends, as well as with other persons involved in the accidents as they recover from their injuries. I ask everyone to please drive with care and caution on our roads at all times. I also extend my sincere condolences to the loved ones of the 6 people who we have lost since our last coronavirus press conference. We have again been harshly reminded of the severity and fatal nature of the coronavirus, and that we must continue to work to protect and to save lives. Tonight, I am joined by the Minister of Health, the Honorable Kim Wilson, and the Minister of National Security, the Honorable Renee Ming. The Minister of Health will provide the country with an update on the latest coronavirus test results, vaccination statistics, and the contours of the country's move to phase 2, in addition to any other matters that she may raise from her ministry. The Minister of National Security will outline the details of the supervised quarantine for non-immunized travelers that comes into effect on June 6th, including addressing some of the questions from the public. For the questions portion of today's press conference, we will also be joined by the Minister of Education, the Honorable Diallo Rebane, who can answer any questions regarding public schools, as well as Chief Medical Officer, Dr. Ayo Oyenoye, and Bermuda Hospitals Board Chief of Staff, Dr. Wesley Miller, who can answer any medical questions. To begin our press conference this evening, we will first hear from the Minister of Health. Minister?
Thank you, Premier, and good evening, everyone. I begin my remarks today by offering my sincere condolences to all of the families who have sadly lost loved ones recently in circumstances related to the coronavirus. While our surge in positive cases has slowed down, it is not all good news. We have had a particularly rough April. Mainly, many people have been seriously ill or have died. The families of the sick and the deceased and their loved ones remain in our thoughts and our prayers. The Ministry of Health received 1,204 test results since the last update, and 3 were positive for the coronavirus. This gives us a test positivity rate of 0.2%. 2 of the new cases are classified as local transmission with known contacts, as they were associated with known cases. The additional new case is classified as under investigation. This case is a resident with no currently linked identified to known cases or a history of travel in the past 14 days. Additionally, since the last update, there are 140 active cases, of which 326 are under public health monitoring and 14 are in hospital, with 2 in critical care. Since March 2020, Bermuda has recorded 2,432 total confirmed cases of COVID-19, and out of those, 2,062 persons have recovered, and sadly 30 are COVID-related deaths. The source of all cases is as follows: 294 are imported, 1,777 are classified as local transmission, of which 1,464 are local transmission with a known contact or source, and 312 are local transmission with an unknown contact or source, and 361 are under investigation. And as investigations proceed, transmission categories may change. The 7-day average of our real-time reproduction number is 0.52%. Bermuda's current WHO country status remains at community transmissions. As you can see from this update, the targets set by the Premier some 3 weeks ago have all largely been met. The 14-day average of unlinked cases is 4, and the target set was less than 7. The 14-day average of the positivity rate is 1.0%, and the target was less than 1%. And the 7-day average of our real-time reproduction number is 0.52, and the target was less than 1. As announced in last week's press conference, with the indicators moving in the right direction, we will move to phase 2 of our roadmap to reopening on Sunday, the 9th of May. At that time, new regulations will take effect. A curfew will be in place every day from 10 p.m. until 5 a.m. Large gatherings will be allowed with a maximum of 10 persons gathered or hosted. The Minister of National Security will have the ability to issue exemptions to the maximum gathering sizes in exceptional circumstances. We are removing the requirement to work remotely. However, remote working is still strongly encouraged. Schools will open on Monday as previously announced by the Minister of Education, who is here to provide further information. Daycare facilities can reopen, and I note interventions are already in place to address issues that were identified during the recent outbreaks. Retail will be opened, and it will be allowed to open at 20% capacity. Grocery stores will also continue to be allowed to be open at 20% capacity, and we will eliminate the current alphabetical system. Restaurants can resume outdoor dining with table service only in addition to their takeout and delivery services. There will be a maximum of 6 persons per table, with tables spaced at 6 feet apart and no milling about and or dancing. Bars and sports or members clubs are allowed to open as well, with outdoor areas only. And like restaurants, there will be table service only with a maximum of 6 persons per table, and the tables must be spaced apart by 6 feet. No indoor dining is allowed at restaurants, bars, or clubs. Nightclubs will remain closed. Weddings, funerals, and other religious services, the restrictions are as follows. Indoor services are allowed with a capacity of 20% up to a maximum of 25 persons. Outdoor services are allowed with a maximum of 25 persons. Congregations and choirs must wear masks and maintain 6 feet distancing. There will be no wakes or receptions which do not comply with the maximum gathering size restriction, which currently is 10. Gyms will be allowed to reopen with equipment spaced 10 feet apart. Staff, personal trainers, and patrons must wear a mask and maintain 6 feet physical distancing. No indoor activities are allowed that require the mask to be removed. No high-intensity aerobic close proximity activities such as spin classes are allowed indoors in limited ventilation settings. Outdoor classes must maintain 6 feet physical distancing between the participants. Recreational boating will be allowed between 5 a.m. and 8 p.m. However, raft ups are still prohibited. Commercial boats, are also known as island boats, will be allowed to operate with limited capacity in accordance with the Marine and Ports licensing. Personal services such as barbershops, beauty salons, spas, massage therapists will also be allowed to reopen. However, they are prohibited from providing services which require the removal of a face mask. Event facilities such as movie theaters, libraries, art galleries, etc., can reopen with a capacity of 20% up to a maximum of 25 persons. As outlined, phase 2 is a gentle reopening, which will see the end of restrictions of household mixing, as well as the reopening of schools, leisure facilities, churches, gyms, outdoor bars, and dining. Limited personal care services will be permitted, and our curfew has changed. All of these changes to restrictions and current guidance will be posted on the government website at coronavirus.gov.bm. As I said earlier, the good news is that our number of COVID-19 cases is on the decline and our indicators are all moving in the right direction. However, our country's status still remains a community transmission, and that frames our reopening strategy. It is still important to get tested, and it is essential to get vaccinated. And we still should avoid household mixing. Avoid being too close to other people for more than a short amount of time as much as you can. The risk of infection increases the closer you are to another person with the virus and with the amount of time that you spend in close contact. If we do not adhere to public health requirements, we will be right back where we were a few weeks ago, with increased cases of COVID-19, increased hospitalizations, and sadly, increased deaths. This transition to phase 2 is not quite our return to life as normal. We will get there eventually if we all work together and do our part. I cannot stress enough how important it is to continue to wear your mask in all indoor settings. You must wear your mask safely to allow it to cover your nose and your mouth. Wear your mask every time you visit the grocery store or any retail store, while taking public transportation or taxis, and for workers at all workplace premises, unless of course you're working from home. Delivery personnel must wear a mask when going about their businesses in accordance with the current regulations. There are exceptions to the guidance. You can remove your mask while engaging in strenuous exercise outdoors, such as running or jogging, but you must put it back on once you have completed your exercise if you plan to be around other persons that are outside of your home. Masks and face coverings primarily protect others, not just the wearer, against the spread of infection. They cover the nose and the mouth, which we know are the primary confirmed sources of transmission of the coronavirus. Remember, I wear a mask to protect you, and you wear a mask to protect me. I also want to remind everyone to keep in their bubbles, or more specifically, your immediate household. Though we have lifted prohibition of mixing, we still must remember that we are in community transmission, and mixing of households should be kept to a minimum, except, for example, small, intimate bubbles. Whether at home or at work, your bubble is not always as small as you may think. You cannot be sure who those people in your bubble in another house is how we got to this community spread. Keep your bubble small. You must remember day to day, some people may have had many interactions, and behind each interaction is a separate household of people. Even if you are working outdoors, you must maintain physical distancing to protect yourselves and other people. Indoor workplace settings should be rearranged if that is what is needed to practice proper physical distancing. If you suspect that you have been exposed to the virus, the worst thing you can do is to move somewhere else to spread the virus. The best thing you can do if you have already been exposed is to stay put and isolate yourself from others. As I've said before, now is not the time to be irresponsible. Gatherings in groups outside of your immediate household or have parties. We must all continue to do our part to stop any community spread. I would now like to take a few moments to provide an update on our vaccine program. We have completed the 16th full week of vaccinations. From January 11th to May 1st, 2021, Bermuda has administered a total of 58,193 vaccinations, and that figure rises to 60,207, which is 52% vaccinated if you include vaccinations administered from Sunday to Wednesday of this week, and that is all very, very, very good news. Of the 58,193 vaccinations administered for the period we are reporting, which ends on the 1st of May, 52% are women and 48% are men. Significant progress has been made in vaccinating our population, and especially our most vulnerable. 74% of all residents over the age of 65 years have had at least one vaccination, with 64% being fully immunized. To date, 51% of our population has been vaccinated with one dose, and 39% of our population has been immunized, meaning they've had two doses. The Bermuda College Vaccination Center will continue to be open for walk-ins from 9 a.m. to 1 p.m. daily. And for those with appointments, the vaccination hotline is doing phone call follow-ups to confirm those appointments, as well as sending emails. For those persons who have registered and are waiting for their first appointment, you will receive the information by email. In both cases, please read carefully your confirmation emails to ensure that you get the correct information regarding the time and the location of your vaccine appointment. Additionally, to increase the avenues available to members of the public who wish to protect themselves and others by getting vaccinated, the Close to Home Vaccination Initiative will continue in the following locations from the hours of 10 a.m. to 2 p.m. This week, Saturday, May 8th at the National Sports Center in Devonshire. Next week, Tuesday, the 11th of May at the Shelley Bay Marketplace. And next week, Thursday, the 13th of May at T.N. Tatum Middle School. Again, those hours are from 10 to 2, and that's the Close to Home Vaccination Initiative. These sites are for people who have not yet registered for the COVID-19 vaccine, do not have access to the internet, and prefer to register in person, or who have additional questions about the COVID-19 vaccine. Our current supplies of Pfizer and AstraZeneca vaccines expire at the end of June. For Pfizer, which requires a 3-week period between doses, we anticipate that the first dose will be administered on the 8th of June. For AstraZeneca, as great as 12 weeks. So we will continue to administer that vaccine until the 30th of June and administer the second dose when we receive our next COVAX delivery. I can assure you, we have the capacity to vaccinate everyone and anyone who wants to get vaccinated, and we have plenty of supply to reach community protection. Before I end, the Emotional Wellbeing Hotline at 543-1111 is available for support from 5 p.m. to 9 p.m., Monday to Saturday. Talk to people about how you are feeling or what concerns you may have. We know that this has been a very, very difficult 13 months for many of us, and we care about your well-being and strongly encourage anyone who may be feeling anxious or stressful. If you have anything that you wish to talk about or you just feel emotionally drained, call the Emotional Wellbeing Hotline. And again, that number is 543-1111. Each of us has a role to play in stopping the spread of the coronavirus. Follow public health guidelines, wear a mask, practice good hand hygiene, maintain physical distance, and download the We Health Bermuda app and do your research. Talk to your doctor and make an informed decision about getting the COVID-19 vaccine. Please, everyone, remember that we all have an individual and collective responsibility. We have to be extremely careful going forward, and we have to do our part to end this community spread of coronavirus throughout Bermuda. Remember to avoid the 3 C's: closed spaces, crowded spaces, and close contact settings. Stay safe, Bermuda. Thank you.
Thank you, Minister of Health. And certainly I thank you and your team at the ministry and all teams involved in our efforts to contain this outbreak for your continued hard work and diligence in guiding us through this difficult period. From the teams in the ministry to the vaccination centers, to the testing teams at Perot and Bull's Head, Penrose Wharf and Star of India, to the lab teams, our doctors, our nurses, and our hospital staff, thank you. I also thank you, the Bermudian public, for your compliance and for your sacrifice. We know that living under restrictions is not easy. It is not easy to stay away from friends and loved ones, especially during a time when we are all going through so much. However, your cooperation has allowed us to be able to look to the future once again. I am thrilled that we can now safely reopen most businesses and that students can return to school. As a parent who has spent the last few weeks working from home with my children, I know that it has not been easy for many parents to balance work and homeschooling. I am sure that students will also be looking forward to being back in school with their friends again. Teachers have also had to adapt and adjust to how they teach and interact with their students. I recognize that this has not been easy, and I thank them for their dedication and the invaluable work that they do each and every day. We especially celebrate them this week during Teacher Appreciation Week, and I hope that all of Bermuda will join me in showing appreciation to any teachers that you know. Also, the Bermuda Post Office will reopen to the public on Monday, May 10th. I extend a sincere thank you to the men and women who work at the post office for their commitment and service to the people and the businesses in Bermuda. Before the Minister of National Security outlines the details for supervised quarantine, I would like to remind the public of our goal. Our goal as a country is to move beyond the pandemic. To do that, we must continue to make the difficult decisions to protect Bermuda from the dangerous variants that now exist in other countries. That protection begins at our borders. By effectively protecting ourselves from new variants entering our community and continuing to lower and hopefully eliminate local transmission, we can keep our schools and businesses open. These measures are not intended to punish anyone, but they are there to protect our country and supervised quarantine. The proposals that the Minister of National Security will now outline on behalf of the government and cabinet are balanced and reasonable and will ensure the protection of public health. We will now hear from the Minister of National Security regarding supervised quarantine and also other matters related to enforcement inside of her ministry. Minister?
Good evening, Bermuda. First, in respect of the recent road traffic fatalities, our hearts go out to the families. I'd like to extend sincere condolences on behalf of the following: curfew exemptions, large group exemptions, enforcement by the Bermuda Police Service, and quarantine guidelines for non-immunized persons. Even though some restrictions are being rolled back, these continue to be concerning times for our community during this next phase. Curfew exemptions. The Royal Bermuda Regiment will also be on hand if they're needed to be enforced on the water, with the curfew now being from 10 p.m. to 5 a.m., it's important to remind the public of the process for applying for an exemption. COVID-19 /curfew. You do not need to apply for an exemption for the following: if you are driving someone who is permitted to be out, going to and from the airport, going to work as an essential to buildings if an alarm system has activated or emergency work has to be performed. Large group exemptions. Large group exemptions can be submitted by gov.bm. A form will be available for people to fill in online. Enforcement by the Bermuda Police Service. The Bermuda Police Service will continue to enforce the COVID-19 regulations. This includes visits to various businesses and restaurants to ensure that patients and establishments are engaging in the appropriate health and safety guidelines. Specifically as it relates to boats and pleasure crafts on the water during the next phase, the public should be aware that the Royal PM and raft ups are not allowed. We are encouraging anyone who sees any breaches of the regulations to please call 211. Quarantine guidelines for non-immunized persons. Here are the guidelines for the mandatory supervised quarantine for non-immunized travelers arriving in Bermuda by air on or after June 6, 2021. By mandatory supervised quarantine, it is meant that these hotel, guest house properties that have been designated as such by the government, all immunized persons traveling to Bermuda are subject to mandatory supervised quarantine and be required to bear all costs for the hotel guest house they choose from amongst the participating properties. The Disaster Risk Reduction Mitigation DERM team will oversee the mandatory 14-day quarantine for all incoming non-immunized travelers. You can only book your hotel up to 14 days in advance of arrival. You must ensure that you have confirmed prepaid. You must change your flight for a date when the government authorized hotel is available, or you should look to book at another hotel. You could face a fine if you don't provide evidence of prepaid accommodation at a government authorized hotel prior to arriving in Bermuda. You can book your government authorized hotel stay through. Have your traveler details ready. Choose and book your hotel. Get confirmation to show at the time of your arrival in Bermuda. Non-immunized foreign nationals who arrive in Bermuda without a confirmed prepaid booking at a government authorized hotel locations. Cocoa Reef, which is $200 for single and $230 for double occupancy. They have 32 rooms available, and each room is equipped with Wi-Fi, AC, refrigerator, and room safe. Grotto Bay Beach Resort and Spa, it's a price of $291 per person, plus $12.50 for an additional person. And they have rooms available June through August 2021 at approximately 100 rooms, and each room is equipped with refrigerator and a room safe. You can have a maximum of 4 persons in per room, and they've also offering a meal plan for $64.35 per person daily. No pets are allowed. The Hamilton room for $356.30. Last year, the government spent over $1.5 million on quarantine expenses. This was due in part to the fact that the hotels were closed. This year, the government is simply not in a position to subsidize the cost of quarantine accommodations. We do appreciate it. Here are some additional quarantine guidelines for non-immunized travelers. The following persons are exempt from mandatory supervised quarantine and are allowed to quarantine at home. Minors, defined as 17 years or younger, and parents traveling with a child aged 4 or less. Seniors, defined as 65 years or older. Medical, internally defined as either having a medical certificate or B, certified essential medical travel, C, certified essential medical companion. Bona fide residents who left Bermuda before May 6 and are unable to meet requirements through no fault of their own will need to define proof of residence and proof of inability to get a vaccine. You're ineligible to get a vaccine because you're a place of residence. For example, students in the UK who cannot get one. You're unable to get access. Persons in the US who may be ineligible to get one. Essential travel to escort a minor to or from an educational institution applies to both parents or guardians, no more than 2. All exemptions, should you require one, will be handled by the Ministry of Health, who are the quarantine authority, as they approve exemptions under the Quarantine Act. In closing, I'd like to say to the people of Bermuda, for the most part, we have managed this pandemic extremely well, thanks in large part to the health guidance and the recommendations that were put in place. So I want to thank all of Bermuda for their compliance and their cooperation. And as we go into phase 2, above all, please stay safe and please continue to make responsible decisions to protect you and your families.
Thank you, Minister of National Security, and thank you to your team at the Ministry of National Security who have worked extremely hard over the last year on the front lines of our response to the coronavirus. The work on behalf of the government in putting this plan together is appreciated. I would also like to thank Cocoa Reef, Grotto Bay, and Hamilton Princess for opening their doors to this proposal and would certainly like to encourage other local hotels to join as well. The policy that the minister has outlined is one that the government strongly believes is reasonable, fair, and takes into account those persons such as minors, the medically vulnerable, and others who are not able to meet the requirement for supervised quarantine, such as students who are overseas, or parents who must travel with their minors for either medical treatments or others, or persons who are traveling for medical treatment or accompanying persons for essential medical treatments. It deals with the issues of students who are unable to access vaccines overseas, and for those who may have left the island before these measures were announced. This is not a policy that any premier or any government wants to implement. And I and the government of Bermuda and this cabinet are no different. Those who suggest that mandatory supervised quarantine is the first choice could not be more wrong. I do not like this policy one bit. I did not enjoy having a state of emergency. I don't like curfews. I dislike having to tell people that you cannot go to church, that you cannot go to school, or telling entrepreneurs that they cannot open their business of which they've invested their savings in. And I do not like the restrictions which have been placed on the ordinary freedoms that we enjoy as a modern society. But what I may like and what may be convenient for us individually must take a back seat to what is in the best interest of keeping Bermuda and Bermudians safe. Too many people have died as a result of this outbreak. People have gone hungry as a result of this outbreak. People have suffered isolation and loneliness as a result of this outbreak. There is a moral imperative to do what we must to keep that kind of pain and upset from continuing. My duty is to make sure that even my personal likes and dislikes do not supersede what is necessary to protect the people of Bermuda from enduring such hardships again. We know that many in the community have asked why home quarantine is not an option for everyone. The answer is that that will be an option that is appropriately, that has been outlined by the Minister of National Security. The reason why it is not an option for everyone is that home quarantine still presents risk. While persons quarantining may not leave their homes, this does not reduce the risk of those persons having visitors under the assumption that it is safe to do so. That person may be symptomatic or have a negative arrival day 4 and day 8 tests and make their own determination that they are safe to be around and decide to invite friends over. After being in close proximity with friends on day 10, they go to a day 14 test and discover they are positive and carrying a new dangerous variant. Their friends who visited will have gone home to their families, gone to work, or into a school, unknowingly spreading that variant and potentially causing an outbreak. The person who let them into their home unlawfully would not reveal this to contact tracers, and we may find ourselves back at square one. This is a scenario we must avoid in order to keep our country from going backwards. Supervised quarantine helps us minimize the risk of that spread, especially that of new variants. We know that the overwhelming majority of persons in Bermuda will adhere to the public health guidelines and regulations. Many will ask why the majority must now suffer for the irresponsible actions of a few. We have seen how those irresponsible actions of a few have significant and detrimental consequences for the entire country. It should be remembered that every outbreak starts somewhere. I can say with a high degree of certainty that this outbreak was caused by a traveler who should have restricted their movements, but ignored that and went to a party and later tested positive. That single reckless act has filled the hospital and the ICU and has closed schools and further wounded an economy that was already trying to recover from previous challenges. What we are seeing in India is what governments around the world have worked hard throughout the pandemic to avoid. Record cases and deaths from a mutated variant, and a healthcare system that is completely overwhelmed with essential medical supplies, such as oxygen in short supply, relative to the amount of people who need it. This is why the government of Bermuda is doing all that we can to protect Bermuda and our healthcare system from such a crisis. When it comes to the question of immunized persons not being required to quarantine despite being able to contract the coronavirus, our policies are led by the data and the scientific evidence. This evidence shows that those who are immunized are far less likely to spread infection to others, even if they do contract the coronavirus. And that is why those persons will not be required to quarantine for 14 days. However, they will still be required to test 4 times during their first 14 days in Bermuda. Many have asked, when will supervised quarantine no longer be required? Ultimately, this will end when the pandemic ends, and we no longer need to be concerned about new variants of the coronavirus, which is the primary reason for this policy. Over time, we may be able to make adjustments, taking into account our local situation, as well as the status of other countries where persons are traveling from. Locally, if we reach community protection and have over 70% of our population immunized, then we may consider reducing the duration period for the quarantine. The government will consider ranking countries based on their transmission status and prevalence of variants of concern, with travelers from or coming back from lower risk countries may be able to have home quarantine as an option. However, at this moment, it is important for all of us to remember that the United States, the United Kingdom, and Canada all have community transmission and all have dangerous variants that are circulating within their respective countries, and therefore the rules apply to the flights from all of those countries. And a recent article had that the P1 variant from Brazil, which has caused Trinidad and Tobago to enter a lockdown and put their hospital system at risk of running out of hospital beds within 7 days. That P1 variant is now the biggest spreading variant or fastest spreading variant in the United States. We are protecting ourselves at our borders to allow for our schools to reopen safely, for our businesses to open, and for Bermudians to get back to their way of life. If we do not adjust our approach to the changing circumstances of the pandemic, there is no way that we as a country will be able to move past it for good. Other countries around the world are adapting with much stricter restrictions. We are now seeing 21-day supervised quarantines being implemented in countries and territories such as Singapore and Hong Kong and Vietnam as they battle new variants. The pandemic is not over, and countries around the globe continue to adjust, as we will do so with the threat of new variants. We have made the calculated and data-led decisions to keep our borders open with strong protections in place. And now stronger protections will come into effect on June 6th, as we have outlined. I would like to remind everyone of the current policy regarding travel that came into effect as of May 5th, which was yesterday. This policy was announced in the national address to come into effect on May 2nd, but it did not come into place until yesterday. I note that many are forwarding the quarantine order which was issued, and that is good, as I want all residents to be familiar with the law. However, it is important to note that these were not unknown and they were announced during the national address. I will remind members of the public what those changes are. First, as a reminder, all non-immunized travelers entering Bermuda will be required to quarantine for 4 days at home or other tourism property pending the receipt of their day 4 negative tests. All fully immunized travelers with a valid negative pretest must quarantine until they receive their arrival test. Immunized travelers without a pretest must quarantine at home until receiving a negative day 4 test. All arriving travelers will continue to be tested on days 4, days 8, and day 14 following their arrival tests. While it is great news that many businesses can open again next week, we know that others will still be affected by the regulations and required to remain closed or operating at limited capacity. The government will continue to support businesses that cannot open and individuals who find their circumstances impacted due to these closures and restrictions. Through the unemployment benefit, the Ministry of Finance has paid out approximately $4.1 million since the beginning of COVID restrictions, which went into place on the 8th of December, 2020. The ministry is aware of some delays in payments, many of which are due to forms being filled out incorrectly, and they are working to resolve any outstanding issues as quickly as possible. Individuals who cannot work can still apply for the unemployment benefit at uba.gov.bn. This week, the Ministry of Finance authorized unemployment benefit payments to approximately 1,500 people for a total of $1 million. And we, as I said, have paid 4,100 persons for a total cost of $4.1 million since these restrictions came into place on the 8th of December. We expect further payments to continue on a bi-weekly schedule, which means that another payment will be this upcoming week. As mentioned earlier, we continue to make progress to resolve problem applications, and last week, 332 applicants were paid for the first time. Since the 13th of April, 3,500 new applications for benefits were received, and of those, 3,000, or 88%, have passed initial processing, and we expect to finish processing the other 500 over the next few days. Of the 600 that are still being progressed through the workflow towards payment, 242 are in process for payment, and 270 require additional supporting documents from either the applicant or their employer. Assuming the applicants provide the required supporting documents in a timely fashion, we expect to bring the outstanding application closures in a short order. On a positive note, 517 persons who were previously receiving unemployment benefits have stated that they have now returned to work. There are 3 other sets of beneficiaries who are also receiving benefits during this period due to the various changes to restrictions that were put in place in advance of the stay-at-home order. Currently, an additional 1,300 persons have received benefits for a total of $2.2 million. $500,000 have been paid out for persons who are required to be in quarantine and cannot work remotely. $1,600,000 have been paid to those persons who are employees of restaurants and or bars that were restricted and or closed, and other mandatory business closures which were put into place for a total of $130,000. I remind businesses affected by mandatory closures to go to bedc.bm to apply for the COVID-19 emergency grant for small and medium-sized businesses. The emergency grants help cover immediate costs associated with recurring expenses, including rent, utilities, social insurance, and health insurance premiums for employees. Bermuda, thanks to our collective work and sacrifice, we have met our targets and can now move safely to phase 2. We must still proceed with caution and care, adhering to the public health regulations, but I am thankful that there could be some form of safe gatherings for Mother's Day this Sunday. While I know that everyone will be eager to get together, the government, as the Minister of Health has said, will ask persons to limit household mixings and gatherings. If you are to meet with persons from other households, please observe the maximum gathering size and try to do so outdoors to allow for low-risk activities. It is important to remember that though our numbers are falling, we still have in excess of 300 active cases. There still are persons in the hospital and in the ICU. We still have cases which are being detected in the community, which are not linked to other cases, and therefore the risk of the coronavirus reestablishing itself is there. That is why we are taking a slow and measured approach. If we move out of community transmission to clusters of cases, there may be some additional changes and adjustments that need to be made. But right now, we need to make sure that we are careful, not moving too fast, so that as we move forward, we can move past this pandemic for good. Before I close, I would like to acknowledge a young Bermudian who sent some positive words of support my way this week. 9-year-old Asia Mello sent me a letter and a wonderful drawing of a Bermuda flag. In the letter, she said that they watch me on TV, they pray for me, and that she wants to be a marine biologist one day, and that she hopes that Bermuda stays strong. Firstly, Asia, if you are watching, I believe that you'll become whatever it is that you want to be in life, and I'm sure that you'll make a great marine biologist, especially one of the best places in the world to be a marine biologist. Thank you for your prayers and your kind words, which have brought a smile to my face. And to Bermuda, in the words of young Asia Mello, I hope we can stay strong together and continue to be united as we work to move Bermuda beyond this pandemic. Thank you, and I'm now ready to accept questions from members of the media on behalf of the people of Bermuda.
Premier, we'll start with Media Maya. As she comes on, I'd like to remind the media that each media outlet is given 4 questions for tonight. Media Maya, you're live.
Good evening, everyone. Maya Palacio here for Media Maya. My first question goes to Minister Ming. If a vaccinated resident returns home and tests positive, will they have to quarantine the government facility on their own expenses?
Maya, I didn't hear your question. I can just about hear you.
And Ms. Palacio, that question is probably most appropriately directed to the Minister of Health. So Minister, could you ask the question again, Ms. Palacio, for the Minister of Health?
Sure. The question, if a vaccinated resident returns home and tests positive, will they have to quarantine at a government facility on their own expense?
Maya, thank you for that. Under the Quarantine Act, if a person comes into Bermuda and they are vaccinated and they test positive, then they will be required to isolate. All persons that are positive have to isolate.
Thank you. So that means that they'll be able to isolate at their homes, correct?
What did she say? Pardon me?
does that mean they'll be able to isolate at their own homes and not at a government quarantine facility?
If a person that's immunized will be required to isolate because they are positive, but they can isolate at their own home because they're immunized.
Thank you. My next question to the Premier: is the government aware that insurance companies in Bermuda have modified their mortgage insurance policies and have now stated that they do not cover a death due to COVID-19 or COVID-19 related? And what is your response to this?
I'm not aware, and I would have to examine the situation further. If you wish to share the information with me, I'm happy to go ahead and look and to provide a response.
Thank you very much. My next question about the Pfizer vaccines. Minister Wilson, when exactly does Bermuda expect to get the next dose if we are supposed to end by June 8th with the Pfizer?
We are expecting the date for the first dose to be June 8th. The extent of the Pfizer that we have on island is due to expire at the end of June. However, if there is a need, as you would know, we did receive the Pfizer from the United Kingdom government. If there is a need for us to get further supplies, then we will have those negotiations and those discussions with the United Kingdom. However, we do have the AstraZeneca, and we are anticipating getting further supplies of AstraZeneca through the COVAX facility.
So my follow-up to that would be with AstraZeneca in the UK, they're not giving it to persons under 30 years old. Is Bermuda following that same practice?
CMO?
Hello, can you hear me? Okay, right. So yeah, the first thing to say is that the AstraZeneca vaccine is a very safe and effective vaccine. There is a real risk of clotting events associated with this vaccine, but the risk is extremely rare. And therefore, this risk-benefit ratio depends on the number or the number of positive cases on island. We've determined that it is still beneficial to everybody aged 18 and above to be offered the AstraZeneca vaccination. So that's the policy of the ministry and of the government.
And my final question.
Thank you very much.
Okay, thank you.
The Royal Gazette, you are live. Please ask your question.
All right there, Adoranka, just working on this. Can you hear me?
We can hear you, Jonathan.
Can you please go?
And can you see me?
Yep.
Yes, great. Okay, Jonathan Bell from the Royal Gazette. And thank you, as always, for having us. If you wanted to start with, we wanted to try and get the demographic of the people at the beginning of the pandemic. I mean, age has been something that's been outlined. I think it's useful to look at factors such as gender, ethnicity, and particularly vaccination status of people who have died. Vaccinated,
Jonathan, you may want to reposition your mic. We're having a hard time hearing your mic, and start over again.
Yeah, okay. Sorry about that. Can you hear me better? I'm closer to it.
That's much better.
All right, it's a long question. Basically, okay, we've lost a number of folks since the beginning of this. We're at 30. We're hoping to get more of the demographics of it in terms of ethnicity and particularly their vaccination status. We're hoping you could tell us a bit about that. Maybe one for yourself, CMO, or Minister of Health.
Okay, I'm happy to take that, Minister.
Cool.
Right, so we publish the data around the breakdown of the ages and the gender of people who have unfortunately passed away as a result of this dreadful disease. So one thing I can tell you is that there is none of the people who have unfortunately passed away who've been fully immunized. That is, they've had 2 doses and had 2 weeks before, after their last dose. We unfortunately had 1 case of someone who's had the 2nd dose passed away. On further investigation, it appears that the person was vaccinated outside protocol. They were already ill when at or around the time of their first vaccination, and I should not have even had the 2nd vaccination, unfortunately, and they passed away shortly after the 2nd dose from a cause that is clearly COVID related. So that bit is, I can tell you that none of the people who've unfortunately passed away have had been fully immunized, i.e. they've had 2 doses and had 2 weeks since the last dose.
Thank you for that, sir. I think, is ethnicity something that is available on that dashboard online, or is that something you can tell us about?
No, we don't publish that, but yeah, we don't publish that. Over 90% of all the deaths are unfortunately from the Black ethnicity.
Oh, I'm sorry to hear that. All right, well, moving on, sir. Thank you. We wanted to ask as well, second one, okay, next door in the US, we have the FDA allowing 12 to 15-year-olds to get the Pfizer shot, I believe next week, under certain situations. Canada looks like they're already on board. Can you tell, is Bermuda looking at doing the same? Where are we at with that in terms of getting those people who are 12 to 15 with the Pfizer jab? Understanding, of course, there's a limited supply of it.
Yeah, so that's another question for me, and I'm happy to take that. So yes, you're right. Yesterday, Health Canada confirmed that they've reviewed all the evidence and have approved that the Pfizer vaccine be given to people who are 12 and above. Yes, like you, I have read the rumors that the FDA is imminently going to comment on that. The Bermuda Advisory Council on Immunization Programs actually met today and reviewed the information that we have and the data from available coming from Health Canada, and pleased to announce that we'll be in favor of implementing that in Bermuda as well. However, as the minister pointed out earlier, our vaccines have been gifted to us by the United Kingdom government under a memorandum of understanding that we can only give this to 16 and above. So we're in the process of working with them to see how we can implement that, given that all our vaccines, all our Pfizer vaccines are through the UK government at the moment.
Thank you very much. Forgive me if I'm wrong. I think we had a figure of 39% of us that are fully immunized at this point. I'm pretty sure that was the figure. I know this keeps coming up. You're probably sick of hearing it, but we have a goal of 70% by the end of May. It's not looking all that likely. We had a survey recently as well that showed there's some reticence, particularly among younger folks and in the Black community. I guess, how are we looking at getting to that goal? It's still, we've got a ways to get there. Are we targeting these folks just, optimistically? How are we looking at hitting that magic number of 70%?
Minister, do you want me to take this? Or do you want to go ahead? Go on, Minister.
Thank you. Jonathan, we have always said that our goal would be to get close to herd immunity by the end of May, utilizing our Pfizer, which would have actually represented 61%. However, you would probably be aware also that we have done, are taking efforts. There's a number of ways in which you can get immunized in Bermuda. You can make an appointment and go through the Bermuda Hospital Board's vaccination center. You can go as a walk-in through the Bermuda College. You can also go take advantage of our close to home initiatives, which are occurring throughout different pockets of areas, certain deserts, vaccine deserts throughout the community, where we have seen a lower turnout. For example, they were in God's country today in the West End and immunized almost 100 persons that showed up at Sand Secondary School to be vaccinated, which is a great number in the course of from 10 to 2. The Bermuda College had approximately 200 walk-ins today. So I think people are becoming more aware and hearing the messaging, taking the advice to speak to their doctors. At the Close to Home initiatives, we have doctors and nurses on staff that are ready to answer any questions that people may have. And we're seeing an uptake in persons interested in becoming immunized and protecting themselves and protecting the members of their community. And right now we have 74% of the 65-year-olds and above are vaccinated or immunized. So we are seeing, you know, great improvements. I think the Close to Home initiative is really, really taking off. You would have heard in my statement that we have another one on Saturday at the National Sports Club, and we'll continue this for several weeks. So we're taking it to people. There are a number of avenues that are available for individuals who wish to avail themselves of protection for themselves and their family through the immunization program. Thank you.
Cool, thank you. Lastly,
Jonathan, just a quick bit to add on, because I know that we want to focus on the negative part, but I think it's also, as the Minister of Health said, we want to focus on the positive side. I know I had an interview with you last week where you asked the same question, and you know there was a big headline that was run on the story in your news article on the exact same thing. So I'm actually surprised that the question is coming again. But I think we need to focus on where we are. And I mean, by the end of this week, we're about 65% of eligible persons to receive the vaccine. Those are people aged 65 and older, have elected to do so. That's 2/3 of the population. So, you know, or sorry, not 2/3 of the population, but 2/3 of the people who are able to actually have the vaccine. And we're seeing more and more persons, as the Minister of Health has said every day. This Close to Home initiative, you know, reveals the reason why you have to make sure you have better access. There are people who, you know, don't have the ability to travel that far. There are people who don't have the ability to register online. There's people who are afraid. There's people who may not be able to read and write in English, and therefore they need to have other types of access. So I think it's important that we recognize that we are doing everything that is possible to get to that target. And whereas other countries have seen their vaccination rates plummet by 75%, we have seen maybe a 35% drop off, which is understandable, but we're just going to continue to do the work. And so when the Minister of Health is saying that we're issuing 3,000 doses, you know, walk-in appointments and continue the work, we are confident that we will make progress. Whether or not it's going to be end of May, whether or not it's going to be June, we will continue to keep the country updated. But what is important to note is that the vast majority of persons who are eligible have elected to get protection for themselves and to help the community.
All right. There is one that I wanted to close upon. We saw Dr. Karika Weldon. She mentioned this on social media, that there were instances of people who were testing negative at the airport, and then it turns out that they were unavailable to get this news, turning out not to be isolating when the regiment visited them. We know it's these imported cases that we want to keep out where we can. I mean, how many of these have happened? Is this something, part of why we're looking at having, you know, unvaccinated people quarantined, in that I guess folks are slipping through the cracks and being checked up on their results of their arrival test?
Jonathan, there's too many scenarios that could potentially present themselves and exist in order for me to address somewhat of a vague tweet. However, the process with respect to case management as it relates to the use of the Bermuda Regiment, and they have been extremely helpful with respect to our efforts to combat COVID, but we utilize them in case management for a number of reasons. There may be circumstances where, for whatever reason, person's phone might be out of service, so we're unable to contact an individual. So we would send the regiment there. So people should not make an assumption that because they see the regiment going to a person's house, that it's for some, you know, nefarious reason. Sometimes we just can't reach the person because their phone might be out, and the regiment go to provide them with information that we need to get for them. Sometimes they're doing wellness checks on our behalf, because remember, an individual that is in quarantine, they will go there just perhaps to do a wellness check. It's also important to note that if you have passed your day 8 test, you're allowed to roam free. Mm-hmm. So if the regiment are going over to do a wellness check and the person's not home, there's nothing wrong with that, because the reality is they're allowed to go free because they've already had their 2 negative tests. So I think it's important that for people to recognize that the regiment serve a number of functions. Principally, it's a very important function to assist us in case management.
You're confident we're covered there then?
Jonathan, if I can just add to that, as you said on the end of that, Yes, that is the reason why we must strengthen protections at our borders. That is it. And I referred into my statement. And, we can talk about that individual case or others, but the real issue is that we must make sure that we strengthen our protections, as it only takes one to lead to this level of challenge of which we've had an experience. So absolutely, that is why it's necessary to do so. And I recognize that people do not like what is necessary, but that is where you have in a once-in-a-century pandemic. These things don't come along very often. And when they do come along, strong action needs to be taken. Stuff that it may not be comfortable, but we have to be in a position to move this country past this.
Got it. Thanks, everyone.
Thank you very much, Jonathan. Premier, we'll now invite TNN to join us. TNN, you're live. Please ask your questions. TNN, you're live. Please ask your questions. We seem to be having a little bit of problems with TNN's audio. We'll come back to TNN. We'll now go to Bermuda Broadcasting. Bermuda Broadcasting. Please ask your question. Bermuda Broadcasting, you are live. Please ask your questions.
Good evening. Don Burgess, Bermuda Broadcasting.
We seem to be having a little bit of problems with TNN's audio. We'll come back to TNN.
Don, I think you got to turn your audio down, Don.
Oh, sorry. Trying to manage.
Bermuda Broadcasting. Please ask your question.
There we go. My apologies. National Security Minister, the issue with the infected Marine and ports pilots is considered by some in the community to be a serious threat to Bermuda's food and medical supplies, especially if COVID is spread to the ship crews. We understand that there's been a death in the Marine port staff recently, and we also understand there have been Marine and port staff in the hospital with COVID. So the risks are no longer purely theoretical. The government has said that new rules coming into place for cruise ships and home porting will mean that only vaccinated persons will be allowed on board. The question is, will this rule also apply to Marine and ports pilots who will be boarding the cruise ships with potentially thousands of staff and visitors on board? In other words, given the new rules, will all Marine and ports pilots need to be fully vaccinated before boarding any commercial vessels, including cruise ships and container ships?
Don, happy to answer that for you. The government of Bermuda does not have a policy of mandatory vaccination, so the answer to your question is no.
Okay, next. Dr. Miller, to follow up our question from last week, do patients, particularly those who are already medically vulnerable, have the right to request that only vaccinated staff be allowed in their hospital room? And if not, why not?
Oh, sorry, I a little trouble unmuting my microphone. The reality is that a patient could request whatever they wish. However, we have to look at the sort of policy that we cannot afford to discriminate against patients, nor can we discriminate where staff is concerned. Also, there are privacy issues, so that I cannot compel any member of staff to say what his or her vaccination status is. That is information, and they may reveal it to an employer on a voluntary basis, but there's no right to demand that information from them. Where I have the right is to insist that the staff wear the appropriate PPE at all times and with all interactions with the patient, and in so doing, keep the patient safe.
All right. So basically, the rights of the staff are more precedent than the rights of the patient.
No, I didn't suggest that at all. I don't suggest that. What happens is that
we know
we
from last week
cannot,
that one patient
Don,
got COVID while they were in the hospital.
but Don, if you come back, just listen to what I'm saying to you. As an employer, whether it be BHP, the government, or your own employer, the employer does not have a right to demand to know the vaccination status of any employee. It is for the employee to volunteer whether they are or they're not. What happens is that in protecting patients, just like patients may not have their vaccine too, but in protecting patients, we make sure that the staff, or we definitely say to them, they should wear the appropriate PPE when treating patients. It is for the benefit of the patient, it is for the benefit of the staff, for the benefit of the entire system. I've said on previous occasions that it would have been my preference for all staff to be immunized. That would have been my preference. However, it cannot be mandated, and I would suggest that if it were government anywhere, be it in Bermuda or elsewhere, there would be a lot of people jumping up and say this is abuse of human rights and it is a totalitarian move. I make no bones about it. My preference would have been if everybody embraced the vaccine, because that is what would make the population safe. That is the way we would reduce the chance of mutation of the virus even within our own midst. Because let's face it, while we worry about the Brazilian variant, we could have a Bermuda variant that could be quite devastating as any of those. And the best way of avoiding that is by having the vaccine. So I thank you and others who help to encourage people to have the vaccine. But at this point in time, like all other employers, we can't force staff to have the vaccine or to disclose their immunization status.
Okay, thank you. Health Minister, for much of the past 7 days, Bermuda was in the top 10 in the world for weekly COVID deaths per capita, and we've been in the top 20 for much of the last 2 weeks. As of today, we are 5th in the world. I know we're not putting up the eye-popping numbers like India and other places, but would you agree that our standing against the rest of the world underscores just how horrific the actual death toll has been here in Bermuda?
I don't think anybody would disagree how horrific the death toll has been in Bermuda. We're at 30, and we saw quite a number in the last week, and certainly the month of April was horrific for all persons, particularly those close ones who've lost loved ones. The reality is that COVID is very serious, and we note that when we have outbreaks, as we saw in recent times, then that increases our hospitalization, and regrettably, the next follow-on move is an increase in deaths. That's why it's important for us to continue the messaging of the importance of the public health guidelines and following the measures, because a lot of the spread of COVID is preventable if persons would wear their mask, exercise physical distancing, quarantine and isolate when they're required to do so, and follow the law and the public health guidelines.
Okay, thank you. CMO, the Turks and Caicos governor, Nigel Dakin, recently warned that if their vaccine targets are not met, the vaccine program will end. He's concerned with the supply from the UK could be cut off if people refuse to be vaccinated. A very similar message was echoed by Cayman Islands Governor Martin Roper last month, and Dr. Weldon and the health minister have indicated the current Pfizer vaccine supplies will be expiring next month. Will you be requesting more Pfizer vaccines for Bermudian children aged 12 to 15? And should the Pfizer vaccine be approved in Bermuda and the UK for children in these new groups, because the AstraZeneca vaccine is not available for children under 18?
So my response to an earlier question about this clarified the position of the ministry. I mentioned earlier on that we have already reviewed this and we've approved this. There are issues around our ability to use the existing stock on island because our MOU does not allow us to do that at the moment, but we're in the process of getting that sorted. So as soon as we have the go ahead to, it has been approved for use in Bermuda and we'll be rolling it out.
Okay, just with the slow uptake with the vaccine portion though, of getting more from England, because part of the
Don, allow me to try to answer that because I know you this whole issue, and I think that it was another question that was asked by the Minister of Health, and so I just want to make it clear that the United Kingdom has stated that they will supply vaccines to overseas territories, the portion of which they have it. If there is a need and demand for additional vaccines, we have no thought or expectation that those vaccines would not be supplied. And so from that perspective, it is about making sure that there is the actual demand. And so what you see in places like the Turks and Caicos, where it is clear if there's not the demand, there's no need to supply additional vaccines. Thankfully, in this country, approaching at the end of this week, 65%, that's close to 2 in 3 people who are eligible for the vaccine, have gone ahead and received at least 1 dose. So we are continuing to hold in a place in the top 10 charts of the world, and we're going to continue to do this. And the work of the vaccination teams has been nothing short of excellent. So the short answer to your question is, if there is a need to acquire more Pfizer vaccine, I expect that the United Kingdom will keep their commitment to their overseas territories and provide it.
Mr. Premier,
Thank you very much, Don. That was your last question. Thank you. Premier, ministers, we'll now go to TNN. We're going to try him again and see if he can come back online with us. TNN, you're live. Please ask your question. TNN, are you there? All right, looks like we may have to come back to TNN. We'll move on to Island Stats. Island Stats? Island Stats, you are now live. Please ask your question.
Okay, good evening, everyone. To the CMO, I asked this question a few weeks ago. Now that we are closer to the goal that the government has been pushing, what professional advice have you offered the government as a plan once we reach this herd immunity?
Well, the professional advice I will give to my minister will be confidential. I would not be saying that on TV. If you want to know what my advice is, I can talk to you about it. But what I tell the minister is between me and the minister.
Okay, so what would be your advice?
Well, if we get to the level that we are aiming for, it allows us to be able to relax some of our restrictions. It makes us feel that bit much more safe, because what we would find is even if we have the infection coming to the community, it's going to get dead-end infections. It's going to, people are less able to spread it to other people, and we are not likely to end up with the sort of outbreaks that will have overwhelming the hospital. And that's why we need to keep pushing to get to that level. And it's not impossible. There are people in the world who've done it, and I know we can't do it in Bermuda.
To the Premier, there was a lot of excitement last week after the Bermuda Day Half Marathon was announced. But also on that day, they also host the Sinclair Packard Memorial Race that officials are waiting for clarity on whether or not they will be able to compete. But more importantly, many people watching this want to know what the government plans are required for cup match to be played and have spectators at the Wellington Oval in really God's country.
Earl, there'll be some people on this call who will agree with you, namely the wonderful Minister of National Security, and others who will disagree with you, namely the Minister of Health. I believe that we've managed to convert the CMO to be a Somerset fan already, so we're making progress. With that much being said, we are not at the place to which to discuss that at this present moment. It'll be something that will be discussed over the next few weeks. We're focused right now and being ready. We recognize that St. George's Cricket Club, just like other event promoters and other persons, want to go ahead and plan and see where we are. So it is still my intent to have a cup match. It is still my intent to have cup match with spectators. But we certainly have not been, our main focus over the last 2 to 3 weeks has not been what is necessary in order to make cup match happen. What our main focus over the last 2 or 3 weeks is what is necessary to move this country past the pandemic. So now that we're at a place where we have minimized local transmission, where we've seen through the work of the public and through the work of our health teams, our national security teams, and others, that we're at this place where we can now make the tentative step to phase 2. The government will be able to start working on other things which are not necessary to preserve.
I know the last time we talked, there was an age group that wasn't allowed to be vaccinated. Any update on that?
On the broad base of CARIFTA is not a government of Bermuda event. Of course, it is something that is supported by the government of Bermuda. But what I can say is that from a perspective position, that we cannot excuse persons and create exceptions for the mandatory 14-day quarantine for non-immunized persons, whether they be CARIFTA athletes or other persons. So from that perspective, that may put the games in jeopardy. There's still discussions and going on with that. I think the best place to check in with CARIFTA. But from the government of Bermuda's perspective, and the way in which we've laid out and the protections which are necessary. The last thing we want is for someone who may be coming from a country, may have a new variant, may have given an exemption, may test negative, convert to positive, and start an outbreak. And that's just not a risk that we can take. So it's disappointing if it does mean the cancellation of the CARIFTA event or the postponement. We're going to continue to work to provide whatever support we can to make sure that it's necessary. But in regards to the overall request of exempting persons who may be traveling to Bermuda for the purposes of participating in CARIFTA from the regulation which we've laid out, we've set out the requirements for quarantine, and those exceptions will not be, the exceptions for supervised quarantine, and those things are not contained in there, but there is no exception from quarantine for non-immunized persons.
Okay, all right. Well, last question. These latest rules have seen a big divide in this country. How do you and your government plan to unite the country in the short term?
I would say that the divide is something that is normal in a democratic society, and it pains me to sometimes see and recognize the divide, and sometimes recognize the views which are held. As I had said in my statement, I do not relish some of the decisions of which I have to make, some of the decisions of which the cabinet ministers have to make. And I have seen the pain inside of members of the government. I've seen the pain inside of members of the backbench. I've seen the anguish for public officers who have literally worked for the last 15 months, weekends, day in and day out, persons around this country. It is difficult. This government is committed to moving beyond this pandemic. And one thing that I know, whether you are whatever side of the divide you're on, we want to return back to normality. And the only way that I think that we can be united is when our sense of normality returns. It is difficult decisions to make, very, very difficult decisions to make. But we are confident that the decisions of which we have laid out and the actions of which we are taking will minimize the risk and hopefully be able to move us beyond the pandemic. So we will, I think, in time, unite. There is certainly some division, but I think I take exception to the view and thought that this government is callous, that this government is uncaring. Because whether it is the significant support of which we've given to those who require the support, whether it is with the with the supervised quarantine, but recognizing not to put persons who are unable to meet the criteria due to no fault of their own, persons who may be traveling back with their students are coming home. We are not trying to penalize anyone. Our job is to keep Bermuda safe. And as I said, we have a moral imperative as a government to minimize the risk to life so that this country can move past the pandemic. And on that, Earl, I would not be doing my job, and none of the ministers of government would be doing their job if we did not acknowledge that as our sole responsibility and be firm and strong in the decisions that we have to make. So thank you for the question and allowing me to share that with the members of the country.
Thank you very much, Ivan Stats. Premier, ministers, we're going to try TNN one last time. TNN, you're live. Please ask your question.
I think you're on mute, Trevor.
Please unmute yourself.
Okay, yes, thank you. We have a situation is for the Minister of Health. There's a couple in Boston that went up to get medical attention. They are due to arrive back on island, and they're watching as we speak. They're due to arrive back on island on Saturday on JetBlue. Last night, and I'm reading from what they sent me to ask. Last night, they were approved with their pre-authorization. They paid the $75 fee. They got an email that states that they are not allowed to enter Bermuda. They need to go back and fill out a form again. And their question is, they both tested negative. They both received the vaccine shots. So the question is, why is it that they're having difficulty returning home? Minister of Health.
Okay, thank you, Trevor. They can contact the COVID hotline. However, oftentimes from what you described, if persons do not, all residents are allowed to land, but if they don't upload their results properly, the TA will automatically be rejected. So they can contact the hotline up until 8 o'clock this evening. So tell them to give a call now at pardon?
They're watching.
444-2498, option 1. And they're open right now until 8 o'clock. But oftentimes the case is this, they don't upload the proper information in a correct way. So tell them to call now and they'll talk them through the process.
Thank you.
Okay, thanks, Trevor.
Cheers. This one is for the Premier. Premier, you mentioned earlier about and I send my condolences to those members of our community that have lost loved ones to this coronavirus. But Premier, you stated that due to my question is, do you not take responsibility for the latest state of affairs here in Bermuda? If you would have shut the island down earlier, would we not be at this point? What do you say to that, Premier?
Trevor, I say hindsight is 20/20. Anything that happens in the country is a responsibility and decisions which are made. We are not looking backwards. We're moving forward. We've laid out a plan, and we're going to execute that plan, and we hope that people will support that plan.
Okay. Let me get a supplementary on that one.
It's still a question.
I'm gonna pass it on there. I'll pass it on B. So I got 2 questions left. Premier, what is the success rate of your WeHealth app? The app is how is it working? Because I've been in contact in the company of individuals where they have identified as positive and looked at my WeHealth app, and it stated no exposure detected in 14 days. And I had a few people that said the same thing. Is this app really working?
Trevor, I can speak from personal experience as I was able to receive a code from the Ministry of Health due to my positive coronavirus test result and entered that diagnosis in the app. And persons who I was in close contact with did receive notifications on their phone. What we have to remember is that this is a privacy-based application. It is not something that can be tracked by government, and it requires persons to enter into their positive diagnosis and to share that positive diagnosis. But we are comfortable that the app is working. We do know that people have contacted the Ministry of Health and the helpline because they have received the notification from the WeHealth app that they have been in contact. We also know that there are persons who have received low exposure notifications because entire offices were using it and were not necessarily required to quarantine. So we do know that the app is working, but it requires individuals who receive a positive diagnosis to enter that information in the app. It is not something that can be controlled by the government. It is not something in which we can look at. It is a privacy-built app, and that is the reason why it is so important. But that is the reason why, in some cases and instances, someone may say they have been around someone, but if the information is not entered, then that's the challenge there.
Okay. My last question. I've been in the presence of many people that have stated that some people are still losing their houses. I was hoping that the finance minister, when are you going to bring the finance minister in, one? And two, has there been any updates on individuals getting second drawdown from their pension? Because people are struggling, Premier. I was told to tell you by one elderly couple that have their own home and they are years of supplies. Can they not draw down? Can you assist?
Thank you on that. Just a couple of things. Pensions are always a difficult circumstance, and I know that persons may always want to have access to the pension. The first thing which I would say is that the pension allowance for people who did not withdraw anything from their pension account still does exist. The second thing is the Minister of Finance has indicated that there is going to be a policy change because we recognize that there are some persons who did not withdraw the maximum 12,000 and only are allowed to make one withdrawal. So I got a message from someone who had withdrawn 6,000 who wants to go back to 6,000 and they're unable to do so. The Minister of Finance has indicated that that will change, and so those individuals will be able to do so. The third thing which I must indicate is that individuals who are at imminent risk of loss of their house, who need for rental arrears, emergency medical items, or others, they are able to qualify under financial hardship provisions which are there. So there will be no one who will lose their house because they cannot access their pension, because they're able to go ahead and have access to the pension if it means that if they do not have access to the pension, they will lose. Is there that is set out, and those things do exist. The Minister of Finance has discussed additional matters. He's discussed those things with the Pension Commission. You've asked when the Minister of Finance will be here, and we're going to be returning to bi-weekly press conferences now that we are out, not bi-weekly press conferences for the coronavirus, but bi-weekly press conferences, the Minister of Finance, Minister of Labor, etc., as we begin to move forward. Because I hope you and the public will recognize that the government has been engrossed with the work of making sure we protect life and lives at this time. So I understand that there's been people who've written into my office. So the news are that the policies and laws will change around persons who may not have drawn the full 12,000 but wish to access more. There's examination of what can be done for those persons who did access the full 12,000 and may require more. It certainly will not be up to 12,000 again, because we're not shut down for as long as the period of which there was. But in the case and instance where people are facing the loss of their home, facing a threat of eviction and other things, they are able to access those funds.
Thank you.
Thank you. Thank you, Premier.
Thank you very much, Trevor.
TNN, that was your last question. Premier, there are no more questions from the media.
Thank you very much, Madam Director. I want to thank all the ministers who attended. Thank the Minister of Education who didn't get any questions, Minister of National Security as well. Minister of Health, thank you again for your team and all the work which you've done. And CMO, thank you very much. And Dr. Miller, I'm sure that the teams over there at the Bermuda Hospitals Boards are gratified that there are less cases in the hospital than there were just a few weeks ago. People of Bermuda, we certainly have made progress, but we do have a way to go. As we move into the next phase of this reopening, please continue to obey public health guidance. We still have community transmission of this virus in Bermuda. There are still cases which are showing up that are unlinked to other cases, and we must make sure that we practice the normal things that are necessary. Washing our hands, wearing our mask, and making sure that we maintain our physical distance, and we as a country will be okay. I thank you to everyone who's been listening. Thanks to members of the media for your questions, and I want to wish all the mothers of Bermuda, including my mother and my wife, a very happy Mother's Day. So with that, I want to say thank you, Bermuda, and good night.
kind of three-dimensional